Hi, I'm Bill Patten, CEO at Holy Cross Medical Center. Today I want to give you an update from the board meeting that was held on February 23rd, 2022. This was a regular board meeting, and the board started by hearing a presentation regarding the needs assessment that we've been working on related to behavioral health, mental health, psychiatric needs. If you remember in previous reports, I've highlighted that Holy Cross was looking at the idea of creating a psych unit here at Holy Cross. And the original idea was to have a 10-bed unit that would be called a distinct part unit under our current critical access licensure. Well, the needs assessment has determined that more than 10 beds are needed. For Taos County alone, 16 beds is the current anticipated need. And if you then look at what I call the halo effect of surrounding counties, another 19 beds potentially could be needed. So as many as 35 beds might be needed. So the conversation we had with the board was we are taking a step back. We're rethinking our plan, and rather than having a 10-bed unit that's part of our current licensure, should we have a separate unit that is separate and distinct as far as its licensure from the Holy Cross operation? Not that it would be a separate business, it would be a distinct business under the Holy Cross banner, just licensed separately so that we could have more beds. The example that I used for the board was that if you have a 10-bed unit and it's perpetually 100% occupied, it doesn't solve your problem. We need to have a unit that is able to accept a patient out of our emergency department each and every day. So an 85 or 90% capacity would be the ideal. So we continue to work on that project, but it's going to be much bigger than the original plan. And as I've reported before, the original plan was $3.5 million. If $3.5 million is a 10-bed unit, you can do the math, and a 30 or 40-bed unit is going to be much more than that. We will need to find new and creative ways to fund a program as important as this. In my report to the board, I highlighted a number of issues related to recruitment. I talked about we have our new materials director on site, Paul Scarcelli. Paul has started. We're glad to have him with us. And then I had reported previously that Patty Pittman was out on an extended leave. So we have brought in an interim manager for our case management program, Saeed Hussein. Glad to have Saeed here. He will help us prepare for our upcoming DNV survey. Sue Romansky reported on recruitment related to medical staff. We continue to recruit for a cardiologist. We also are recruiting for 2 family medicine docs that also do OB. And spoiler alert, I'm hopeful at my next report that I'll be able to say that at least one of those positions has been successfully filled. On the finance front, I had reported last month that we were looking at the possibility of writing a grant or submitting a grant for a HRSA program on workforce development. We had talked with the University of New Mexico Taos campus. We had talked with the City of Taos and a number of other healthcare organizations within our region. The problem with this grant was that the timeline was so short. It's due the 18th of March. So we decided we weren't going to be able to meet that timeline, as useful as that grant funding would have been. But what we have determined is that with the number of grants that we believe will become available over the next couple of years, whether they be operational or infrastructure in nature, we think we need to hire our own grant writing capacity. So we're going to be looking whether we hire a full-time, a part-time, a contract person, but we're going to be adding some sort of grant writing capacity here at Holy Cross. On the operations front, I've already mentioned that we're expecting the DNV survey. That's the annual survey we have every year that assures that we're in compliance with the Medicare and Medicaid regulations. We're expecting this survey in April. We believe that it will be an on-site survey. Last year, it was a remote survey because of the pandemic. We think that it's going to be on site this year. So in an effort to make sure that we're ready, we're going to actually do a mock survey. We're going to have a surveyor come in and do a 3-day, run us through the mill to make sure that we're as prepared as we can be. That mock survey will be happening yet this month so that we can be prepared for the actual survey when it happens. As I say, we expect in April of this year. On the COVID front, our COVID numbers are significantly down. Instead of having 10 to 15 COVID patients in the hospital each day, it's now 0, 1, or 2. And we haven't had anyone on a ventilator for quite a few weeks. Knock on wood, that's very good news. Outpatient numbers also continue to be down. The number of employees who are COVID positive also continue to be down. But there are other lasting effects from the pandemic. We continue to have supply chain issues. Most recently, it's the tests that we use to do the COVID testing. Those have been back ordered. We have a number of different tests available to us. All of them were back ordered. So we've now added antigen testing as an in-house capability just to be able to help bridge the gap until the supply chain issues are resolved. On the staffing front, compensation has been upset by the COVID pandemic. I've talked in previous reports about the number of traveling staff that we have and the inflated salaries that we have to pay to them. We still have difficulty getting an adequate number of travelers, permanent staff to fill our positions. So we're starting a project to look at how compensation has changed as a result of the pandemic. We've purchased 2 external salary surveys so that we can make sure that we are benchmarking appropriately. We will update that information to reflect the change between when the salary was done and the current market conditions. We will look at where our salaries are and compare them to those surveys. And then we will reach out to our union and enter into negotiations to update the salary scales and to move employees as are appropriate based on the changes that we find in the market. We also have determined that we cannot wait until positions come open to look at filling them. So we are creating what we're calling a mission critical list of jobs within the organization. We're going to identify the employees in those jobs, look at where they are in their career. Are they 2 years from retirement, 10 years from retirement? Do we have someone in-house that is trained to take that job? If not trained, do we have someone that is capable to be trained? If not, do we need to recruit locally, regionally? Is it something we even need to go international? So we're trying to be far more proactive and also much more strategic, long-term thinking in our recruitment efforts so that we can address some of the changes that we have seen as a result of the pandemic, and we can stabilize our workforce as we return to whatever this new normal is going to be. On the IT front, we're taking steps to insulate our servers from power fluctuations. We have purchased a large uninterruptible power supply, UPS for short. We are working to get that installed. It is a much more complicated process than was originally thought, but it is something that once fully installed will really help to insulate our servers from the ups and downs that electricity in our community often experiences. And I touched on strategic thinking as it relates to staffing. I also suggested at this board meeting that the board undertake a formal strategic planning initiative. While we're not completely away from the pandemic yet, I think we are far enough that we can begin to predict what our future needs to be. And I suggested to the board that we think short term, the rest of 2022, midterm, 2023 through 2025, and then long term, 2026 and beyond. We need to start making plans for how we can adjust the services, evolve the building. In previous reports, I've talked about the master facility plan that we're working on that is looking at the psych unit that I've already talked about, renovation of the hospital, and creation of a medical office building. All of those elements will be part of a strategic planning conversation. But we can't wait for a strategic plan that I hope would be approved at the May board meeting to begin talking about some of the updates that our building needs. Examples include our ICU needs to be remodeled, our med-surg unit needs to be remodeled, labor and delivery is another unit that needs to be remodeled and updated. Our floors need to be replaced. Our public restrooms need to be updated. Because our bottom line is much more healthy this year, given the volumes that we've seen and the acuity of the patients, we are going to try and invest some of that money that we've earned into the building on these smaller projects as we work to develop the long-range, bigger projects that are going to take debt in order for us to be able to accomplish them. The last comment I'd like to make relates to our staff. At the beginning of the pandemic, everyone was talking about healthcare heroes. There was a lot of support for the employees of Holy Cross and the other healthcare providers in our community. As the pandemic has worn on, the patience of the community has also grown a little bit thin. And it's much more common that people are taking out their frustrations, which many times are political in orientation. We don't make the rules as far as masks. We don't make the rules as far as vaccine requirements. We just have a requirement to comply with them. But our patients don't understand that. And so they take it out on our employees. I would ask that as you interact with the Holy Cross employees and we provide the best care we can for you, that you would be patient with our employees, that you would be kind to them and understanding. And when they ask you to wear a mask, as they will until the rules change, please comply. It's not anything they're doing to make your lives miserable. It's not anything they're doing to conform with some political agenda. These are rules that are dictated to us. We have a responsibility to comply with them. So continue to be kind and understanding of your healthcare providers. Thank you very much.